It's a pleasure to have you here. The details now. 4 passengers are feared dead and over 30 others in critical condition after a road accident Tuesday dawn on the Nasia Bridge near Wale Wale in the northeast region. The commercial vehicle was loaded with 45 passengers traveling from Kumasi to Boku. JoyNews correspondent Ilyasa Tanko at the scene reports the vehicle has mangled beyond recognition and that security and fire service personnel conducting rescue operations were using chisels and hammers to pull out some of the victims. JoyNews also gathered that the accident occurred at about 3 a.m., but the rescue operation delayed as it was hampered by a lack of ambulances to carry victims to the hospital. The situation has caused massive gridlock on the Tamale-Bolga Highway, one of the busiest transport corridors, as vehicles traveling on the road have been stuck as personnel still struggle to clear the damaged vehicle. Ilyasa Tanko is our man on the ground and he's been monitoring the event both at the accident scene and the hospital. Ilyasu, how was the hospital coping with treating those who are critically injured? Hello, Ilyasu, if you can hear me, just tell us how the hospital is coping with treating those who are critically injured. Too bad we are struggling with hearing Ilyasu, so we'll try and raise him and hear him better. While we wait for him to get back to us, there's a passionate appeal from a frontline health worker who's lost patience to COVID-19 and seen many endure the excruciating pain of battling the disease. The health workers say they're getting overwhelmed by the rising cases of COVID-19. They tell JoyNews' Matoda Gavi that caring for COVID-19 patients require painstaking, difficult procedures which can subject the entire healthcare system to serious stress. There's more in the following report.
It's a room of excited critical nurses at the Ga East Hospital. 4 of them are getting ready to enter the ICU. Sewa Akutu is getting ready for the day's task. Inside the changing room, she is helped by other colleagues to don PPE. Wearing these protective things alone can take about 10 minutes. It's a careful, thorough process that largely saves the frontline workers from getting infected. Sewa heads for the high dependency unit. Being in this room is like hanging off a cliff. The fear of death, pain, and anxiety fill every inch of this room. There are 4 patients in dire need of help from Sewa and her colleagues. It is Sewa's turn for the 4 days, 12-hour shift. A shift that becomes strenuous when you are dealing with COVID-19. The more critically ill the patient is, the closer nurses cooperate with doctors in providing life support treatments.
Yeah, what we do is most of them, we manage their symptoms as they come. Some of them come with a low oxygen level, some come as low as 64%, at the one that I showed you. So we put them on oxygen, we give them high flow oxygen, we try to build them up, and some of them to manage their symptoms. Some come with comorbidities like diabetes and other things, so we try to manage those conditions as well. So it's a whole kind of thing. It's not just one specific thing. Yeah.
Sewa moves from one patient to the other, checking monitors. Occasionally, she speaks to the patients who only nod or give thumbs up as response, since they are all on ventilators. 2 of her patients are restless. 1 is gasping for air. Another nurse reaches out to one of the patients and carefully adjusts the pillows, while 2 other nurses make a dash for the oxygen cylinders. There are different life-saving activities going on at the same time. Other nurses and a doctor monitor the activities in here through a window.
So they stand outside with all our plan inside. So if we are supposed to do anything like say give this medication, they communicate to us We ask them, you tell them the vital signs, write this out. They're supposed to give this, and they tell us. And sometimes when you are doing something, they see from outside, they will prompt you. This thing has gone off. Can you do something about it? Okay. That's what basically they do. Okay. Yeah, that's what we all do. Okay. And then once we go in, we are not here all the time. We do come in as time is needed. So we will be standing outside and then monitoring them from at the back of the window.
The nurses leave nothing to chance, as one of them for close to 20 minutes holds an oxygen mask to the face of a patient while the oxygen is being fixed. What are you doing?
It's an oxygen, and then the system has gone down. Okay. So I'm just maintaining it, the level, so that he can take it.
So that he can become stable?
Yeah. So when they bring the other cylinder, then we can put him on it. The system, this is a central oxygen system. Okay. Yeah. Okay. And the system is down. So you can see here, it's written low oxygen flow. So they are now working on it for the system to respond, and then it will be normal. Okay. All right.
They are confined to the steaming PPE. The only break is to lean against the wall or squat briefly in between the checks.
And we are overwhelmed with the rise of COVID cases now.
Help by masking up so the cases can be reduced.
Let's try and observe the safety protocol. Health workers are overwhelmed now. We are breaking our back, so please try as much as possible to do as you are told. Mask up, wash your hands. I mean, observe the safety protocols. Help us to help you. You can see our staff strength, we are not enough. You see, we had a challenge with the oxygen now, and most of us had to dawn in. I had dawn in the morning and gone out around 12. I had to come in again. You see, I'm panting. Even as I'm talking, you can see that I'm not really in there, just moving about. So there's a lot to be done. And I don't know, the public is not, some of them think that COVID is not real. We are exaggerating, but no, COVID is real. There's a lot of cases here. We do lose some of them. So it's better to be in the comfort of your home than being in an ICU.
The long hours, the stress and anxiety that comes with treating COVID-19 patients are affecting them. Because for Sewa and her colleagues, every day at work means a fruitful exposure to the disease that has killed some of their patients.
It's really affected us psychologically. Coming to work every morning, we work for 12 continuous hours for 4 days. You take 3 days off, and you are called at any time to attend to an emergency. Being a critical care nurse, you are called at any time to attend to emergencies. And so for us coming to work 12 hours, leave your family at home and come and work, and sometimes when you come, you nurse a patient, the next morning you come and the patient is no more there. It's like you've done a lot to save a life, but then the life is gone. So we are really going through a lot emotionally. We are breaking our backs. It's really affecting us a lot.
For a medic who combines administrative and clinical works like Dr. Joe Mensah, the past 2 weeks haven't been easy for his family.
Well, it's been difficult, not just for me, but for my colleagues as well. We're running longer shifts, we're running more days because of the numbers we're seeing. And for my family, I understand it's been difficult, my wife, my kids. Unfortunately, I couldn't even take my kid to school when he reopened. Because I've spent the past 2 weeks, I've practically been here every day. And for some of my colleagues, it's been the same story. We are pushed to the wall, but then we need to offer the services to our clients. So we're doing this for God, we're doing this for country and for our patients.
Psychologically, is it having a toll on you?
Yes, it's been stressful. It's been stressful. I have an appointment actually with my clinical psychologist. I should have had it yesterday. Hopefully I'll have it today because it's been stressful. Wow. She thought I should come see her for a session. And it's important that the public know that COVID is real. A lot of people still do not believe there's COVID until it comes right to your doorstep. It affects every relative. But then do not wait to that point when you unfortunately lose a family member. COVID is real. For corporate organizations who have been supporting us, yes, we need some PPs, but we also need some toiletries to support the patients we see, food items, etc., are all welcome. So if you have any support for the fight against COVID, we are always welcome. The infectious disease center is also open, and for both facilities, we're doing our best in the fight against COVID. Come and support us. Come on board.
Sure. The Ghana Registered Nurses and Midwives Association recently reported that 4 nurses have lost their lives since the pandemic broke. 840 have also been infected. The nurses are calling for insurance packages for those infected. They also want government to reinstate the incentive packages for nurses, as some of them are yet to receive the 50% allowance announced by government since the onset of the pandemic. For Joy News, Matilda Gavi, Ga East Hospital.
Now let's go back to our earlier story where 4 passengers are feared dead and over 30 others in critical condition after a road accident Tuesday dawn on the Nasia Bridge near Wale in the northeast region. The commercial vehicle was loaded with 45 passengers traveling from Kumasi to Boku. And our correspondent Ilyasu Tanko was at the scene and reports the vehicle was mangled beyond recognition. He joins us on Zoom from the hospital. Ilyasu, are you at the Wale hospital? If you are, tell us how the resident or the hospital, I beg your pardon, is coping with treating those who are critically injured.
Well, yes, Benny, I'm currently at the Wale Government Hospital, and you can see in our shots is the medical superintendent here, and he's going to tell us how the hospital is managing this particular case. Doc, good morning, welcome to Joy News. Talk to us about how you're handling this particular accident victims that continue to troop in this particular facility.
Yes, at about 4 a.m. this morning, we started getting casualties from the accident scene. And a total of 21 victims have been brought. Just a few of them are seriously injured. Currently, we have managed most of them. We are stable. It's only true that we are preparing to send to TTH for further management. They have sustained their injuries are quite serious, and we need to send them, stabilize them, after that we send them for further management.
How many casualties or fatalities that you have in your hospital?
For the, I think, like I said, there are 21, those who are in this room. There are 21 who were brought in. 2 of them severely injured. And I think we had about, at our mock now, we have 5 dead bodies, 3 adults and 2 kids. So that is the situation.
So, Benis, as you can hear, that is the medical superintendent of the hospital. The nurse manager at the hospital talking to us about how the hospital is handling this particular case. I must say that the hospital, the emergency ward where I'm currently standing is full capacity. I understand some of the victims have moved to other wards, and you can see a lot of nurses, at least a dozen of them, standing and offering treatment to these victims that have been brought here.
Eliasu, quickly and briefly, do we know what caused the accident?
Well, what we do know is that the driver says he was suddenly crossed by a group or herd of roaming cattle. But when I went to the scene, the passengers who survived dispute this particular account. They insist that the driver on multiple times were warned that he was sleeping while driving. And so they believe that as a result of the sleep driving that the driver was doing that caused this particular accident. But like I said, authorities are still at the scene trying to clear the vehicle in the first place, and then subsequently they will be able to tell us exactly what caused this particular accident.
You sent us videos showing a gridlock on the Tamale-Bolga highway. What's the current situation?
Well, the situation there is a gridlock situation. There are a lot of cars that have parked there. Before I left there, the authorities or the rescuers actually were able to create a small path And so before I left there, I saw vehicles that were coming from the Bolga section of the road able to cross, but those that are coming from Tamale are still parked there. And a lot of traffic is currently building up on that busiest transportation corridor.
Ilyasu, we understand there was a bit of struggle for the ambulance service to reach the victims.
Benny's, please come again.
I'm talking about how quickly the ambulance service was able to reach the victims.
Well, that's the concern that authorities of this facility are also raising. They said the accident happened somewhere 3, but the victims started coming here in around 4 p.m. And so that's about an hour and a half interval before the arrival of the victims. But where the incident happened is just 20 kilometers from Wale Wale, where the hospital is currently. But what we are able to learn is that when the incident happened, when they called the ambulance service here in Wale Wale, the response that they got was that the accident, the vehicle is faulty and will not be able to move. And so as a result of that, the police who were at the scene were compelled to use their vehicle and other trucks to convey the vehicle from the scene to the hospital. And so it was until when they called the ambulance service from Sapulugu, which is about 60 kilometers away from the incident, that's when the vehicle also came and helped convey the victims to the hospital. It's really a serious situation. When I went there, we understand some of the victims even fell in the river as well. And so, like I said, authorities are still there trying to clear the road and also ensure free flow of vehicular movement.
I'll end this pretty shortly, but you mentioned something entering the river. I didn't get that.
Benny's come again.
I'm saying that you mentioned something entering the river. Do you mean mangled vehicle? What exactly were you saying there?
Yes, I'm saying that the authorities also, that some of the rescuers actually find some of the victims in the river. They retrieve some dead bodies from the river. And so it means that when the accident happened, some of the victims actually fell in the river, just over the bridge, they fell in the river. And so I'm saying that some of the victims were retrieved from the water as well. All
right, we'll leave it here. Eliasa Tanko is our correspondent in the Northeast region, giving us updates on that unfortunate incident that happened around 3 a.m., we understand, in the wee hours of Tuesday. Now, there's growing resentment among caregivers at the Komfanochi Teaching Hospital over the management of COVID-19 cases at the facility. 8 confirmed cases have been recorded at the Child Health Directorate in the last few weeks, with the caregivers accusing management of putting their lives at risk as suspected coronavirus cases are managed alongside regular patients. Ohiming Terry has more in the following report.
Doctors and nurses at the Komfanochi Teaching Hospital's Child Health Directorate say there's no concerted effort by management to either test staff who come into contact with COVID-19 cases or close down wards for fumigation.
We have been told that we cannot refuse care to anybody. So I think our facilities are doing their best not to return anybody who walks into the facility being ill. And by so doing, they are also increasing the exposure rates of every other person around. It's been almost a week now, but nobody has been called or contacted about testing the staff nor the relatives. A lot of us are embittered by it. We keep complaining, we keep passing comments. But I mean, we can only talk in the background. If there is anything that can be done, it is about management helping us out.
A nurse who spoke on condition of anonymity says the over 400 caregivers are compelled to work without the right protective gear. She says the development puts their immediate families and that of the public at risk.
There has been a clear lining that we should have frontline health workers who have been trained specifically for the management of COVID-19. But as it stands, it looks like every health worker is capable of managing COVID-19 at any little space on the ward, which is not supposed to be so. It exposes both the patient, the health workers, as well as the relatives who come around these patients. And it makes managing COVID-19 quite difficult, because we know that COVID-19 should be managed, 1, in an isolation, 2, by trained professionals, and 3, with specific PPEs. And all these 3 things are being lacked. We initially had suspected, and getting results was a problem. Finally, when they became confirmed, we had to manage them on the ward, because as we are being told, there is currently no trained personnel and no specific place to keep those patients. So they were being managed on the ward. In the first place, we don't even have social distancing on the ward because the wards are full. We had to manage these patients side by side with the average normal sick patients.
According to her, caregivers are appalled by the failure of management of the hospital to close down affected wards for fumigation.
Ideally, the ward should have even been closed down by now, once we got to know that there was a patient who had been on the ward and the exposure was to virtually every nurse and doctor, because for 3 weeks, every nurse would have had contact with the patient, so that these nurses could have been given an isolation plan at home with prophylaxis. And then, if possible, each nurse should be tested. And then based on the test, we would know who can return to work and who needs to stay home. Since we've had an increasing number of 8 in just 2 weeks, the probability that we may record more in no time was possible, and so we should be prepared for it. It's quite traumatizing and scary.
Management of Komfanoche Teaching Hospital has expressed concerns over the issues raised and promised to respond at the appropriate time. From Kumasi, for Joy News, Ohiminteria reporting.
Now, throughout this pandemic, the use of high-concentration alcohol in hand sanitizers has been strongly recommended. But as cases of the virus begins to increase in Ghana, a university professor says the inclusion of hydrogen peroxide in the management of the virus could potentially save many lives. A number of health professionals have agreed with this study. Here's how to use hydrogen peroxide, as Reverend Professor Kwame Nasego said on the AM show earlier.
So what we're recommending is that 3% is harsh. What we're recommending is for you to use just 1% to gargle. 1% meaning that if you take 1 part of the hydrogen, most of the bottles on the counters are 6%. So if you take 1 part of it, you add 5 parts of water. So let me make it simple. If you take 10 mils of hydrogen peroxide, you want to add 50 mils.
We had to break in that to take you back to the Supreme Court. You know, they went on recess. They're back now.
It's referred to the following rules of court. Rule 69C4B of the Supreme Court Rule CI 16 as amended by CI 99, which reads, quote, the court may A. Dismiss the petition where the petitioner fails to file the processes regarding the petition within the specified time, or B. Hear and determine the petition where the respondent failed to file their answers or the processes regarding their answer within the specified time. Indeed, this position in the procedural rules of the Supreme Court relating to presidential election petition is echoed through the different hierarchies of courts in current case management structure and will not be compromised. Order 32, Rule 7A, Sub-Rule 3 of the High Court Civil Procedure Amendment Rules 2004 CI 87, which governs trials in the High Court, has a similar provisions as follows. Where a party has failed to comply with any of the directions given at a case management conference or pre-trial review or both, the judge may make any of the following orders. A. Strike out the action if the non-complying party is a plaintiff. B. Strike out the defense and counterclaim, as the case may be if the non-complying party is a defendant. C. Order any party to pay cost. Or D. Make any the appropriate order. End of quote. The petitioner is again directed to file his witness statement on the matters raised in his petition and other pleadings, and his response to the preliminary objections by close of the day on Wednesday, the 27th of January 2021, failing which this court will proceed to invoke the sanctions imposed on this court by the rules of court. The petition is thus adjourned to Thursday, the 28th of January 2021 for hearing.
We're grateful to your lordships for giving us the opportunity to file the witness statements, and we would like to state firmly, my lord, that we did not by any means intend just to disregard your orders. That was never the intention. As we indicated, we had expected that there would be an opportunity for us in the witness statement to include some of the matters that were the subject of the discovery processes. But in any case, your lordships have ordered for us to proceed with filing tomorrow, and we will apply, we will act accordingly, and we're grateful for your indulgence.
We are grateful to the court.
It's grateful.
Rise.
Be it for the Supreme Court in hearing that election petition brought to it by the NDC's John Dramani Mahama. Sitting will resume on Thursday. But earlier, the court went on recess to decide what happened next in regards to Mr. Mahama's team refusing to obey its order to file witness statements and legal arguments relating to the initial objection. And you will recall that Mr. Mahama's team wanted the hearing to be put on hold until the issue with regards to the court's decision on the questions they wanted to pose to the Electoral Commission was reviewed. But, well, we understand that they're supposed to file their witness statements by close of day, and sitting will resume on Thursday. Well, now let me bring you back that story on the use of hydrogen peroxide in the management and prevention of the coronavirus pandemic.
So what we're recommending is that 3% is harsh. What we're recommending is for you to use just 1% to gargle. 1% meaning that if you take 1 part of the hydrogen, most of the bottles on the counters are 6%. Mm-hmm. So if you take 1 part of it, you add 5 parts of water. So let me make it simple. If you take 10 mils of hydrogen peroxide, you want to add 50 mils of warm water, lukewarm water, something you can gargle, to give you a 1%.
10 so and then add 50 mils.
Yes, so okay. It's a 1 part in 1 part plus 5 parts. So it's a 1 part in 6 parts, which gives you a 1% from the 6% that you have. Most of the ones I've seen on the counter, I've not seen any other concentrations. I've seen 6% most of the time, Bells, yes, and another one, but they are mostly 6%. So basically what we are trying to use, what we are encouraging people to use this as some sort of a prophylaxis. We're saying wear your mask, do all the things you're supposed to do. I use it when I get into meetings. I mean, Dr. Bidako, I heard him saying it. No matter how you try, there are some people around you who will not put on their mask. You try to avoid them. But sometimes you are in circumstances where all the best you can do is probably to keep your distance and not completely to avoid them. So in that case, when I think I've come into contact with people, a situation like that, then I gargle. Or we are recommending, therefore, that if you have people who have been infected living in the same house, they could then use it as a gargle to reduce the possible chances of the virus establishing infection in the upper respiratory tract infection. There are more uses that some others have put to it, but I don't want to bring it up here because I think it probably creates more. So just the
final. I asked, what if you were to swallow in the process? You swallow the substance. What's the danger?
It can give you an irritation in your stomach because of the nature of the thing. So the idea is that the reason why we are recommending that you should reduce the concentration to 1% is to be able to take care of the possible irritation. But you are supposed to gargle and pour out. And that's why we say that you don't recommend something like that for children below a certain age because they cannot gargle. My son is 10 years old and he's learned how to gargle. He knows how to gargle. I don't make them gargle all the time, but depending on circumstances and where we've been, I sometimes make them gargle and he manages to do it. So it's a matter of gargling and throwing out. It's a matter of not giving it to children. Some are proposing below even 12 years because they are likely to swallow it. But for people who can gargle, let them gargle. There's also a recommendation there that if the person cannot gargle for a reason, maybe age or having problems swallowing, what you can actually do is to put it on some sort of a cotton bud, and then you can then swab or clean the orifices so that the person then does not have to gargle and swallow. Okay. So it depends on the circumstances and who is gargling. Okay. But let me state this. We are not saying that this is replacing everything. We are saying that it's just an addition to what is being done. And then I also should mention that we should remember that vitamin C itself, in the process of metabolism in our host, actually produces hydrogen peroxide. So it is not